And joining me now is Dr. Adam Brown. He's an emergency physician. He's also the chair of the COVID-19 task force. Dr. Brown, always a pleasure. All right, so the Omicron, good to see you as well. The Omicron strain spread quickly in South Africa, but the director for the National Institute of Health says we should also remember that COVID levels in Africa were already relatively low. How concerned should we be here in the U.S.?
Well, I do think there is a certain level of concern that we should have, but it may not be for the reason that you're thinking right now. The reason why I'm concerned is more than 99% of the viral cases that are here in the United States today are the Delta variant. And that variant, we know, still causes a significant amount of illness, severe illness, hospitalizations, and deaths. And we know that more than 41% of the United States population are unvaccinated. Now, that being said, we've got to get vaccinated, we've got to get boosted, and there's still a lot we don't know about the Omicron variant. And so once we learn more, we'll know what we need to do and how we need to change perhaps our messaging. But I do agree with what the president said earlier today and what's coming out from the public health agencies, that getting vaccinated and especially getting boosted if you have gotten your vaccines after June is a really important way to mitigate the spread of Delta and potentially protect us from the Omicron variant.
All right, Dr. Brown, I got to ask this question. I mean, if every American was fully vaccinated, right, what good would that do us if the rest of the world isn't?
You know, that's such a good point there, because just like with this variant and with the other variants, they've come across our borders because we're all interconnected. And so we have to have a vaccine strategy that is not just getting the United States vaccinated, it's getting the rest of the world vaccinated. That's the only way that we're going to prevent more and more variants from coming across the United States, but also around the world. If you look at places like Africa and other parts of the world, they have very low vaccination rates. So part of our strategy as a world community needs to figure out how do we get vaccines to those parts of the world that don't have them, because otherwise we're going to continue to have more and more variants of concern coming to the United States. So we really are all in this together, and we can't consider ourselves completely protected here in the United States until we're all protected around the world.
Exactly. All right. Well, the president spoke earlier when he addressed the nation. He mentioned that at this time, according to Dr. Anthony Fauci, the vaccines are enough protection at this time. Still, we have a lot of questions, not many answers in regards to this new variant, right? But he did mention that Pfizer and Moderna are already on standby if they need to come out with a new advanced vaccine. Is this going to become part of our, I guess, yearly lives where we get a shot every single season? I mean, COVID's here to stay.
That's right. It does look like that COVID is here to stay, just like influenza is here to stay with us. Now, the levels at which we have immunity may change as we have more and more get the disease. There's a certain level of immunity that will take place within communities. So that is something that time will tell. But I do agree with you that we are going to see this for a while, and there's a possibility that every year or every few years that there'll have to be some changes made with the vaccine. Remember, with flu, we do have a new vaccine that comes around every year. But we've had some time with the flu. We've had hundreds of years with the flu. So we've been able to see how we can respond and how we can have vaccine manufacturers make different strains of the vaccine to attack the different strains of the flu. We may have to do the same here with the coronavirus. That said, with Omicron, just to put that in perspective, Pfizer came out today and Moderna came out today and said that it could take about 100 days to be able to create a new vaccine against this new variant, if it's needed. And we'll just have to see if it's needed.
All right, Dr. Brown, we got about 40 seconds. What concerns you, sir, as a medical professional in regards to this new variant now?
Actually, what concerns me more is that people are going to hear that the Omicron variant is either A, not as affected by the vaccine, and that may make people think that, hey, I don't need to get the vaccine. But they're forgetting about the Delta variant. It's still here. We're seeing large amounts of increases of this variant in Michigan, in Arizona, in the Northeast, as people are gathering for the holidays. And as you can see, I'm excited about the holidays too. It's important that we remember to get vaccinated, boosted, encourage our friends and families and kids over the age of 5 to do the same, because That's the most concerning thing. So don't let Omicron to be a distraction at the moment. And as we learn more about it, then we can make the appropriate recommendations at this time.
Yeah, Dr. Brown, I might add, that's a good looking tree back there too.
Okay. Thank you. I appreciate it.
Dr. Brown, thank you for joining us, sir. You and your family be well and happy holidays. Speaking of holidays, online shopping